Good afternoon, everyone. We thank the City of Milwaukee Mayor Tom Barrett and our neighborhood alderman, Cavalier Johnson, and the Health Commissioner, Dr. Coakley, and Dr. Coakley Chief Staff, Lillian Payne, who was so gracious to be here with us today. Greater Mount Sinai uh, vision is to reach out to our community with the life transforming power of the Holy Spirit. But we are not naive to the fact that there are people that have been destroyed because of the lack of knowledge, according to Hosea 4 and 6. Our ministry as a part of this community in the great city of Milwaukee and has been serving the community nearly for over 60 years. We felt the importance of hosting a COVID-19 community awareness meeting with the city of Milwaukee as we proceed by the directions of our Miss Keisha Terry. I want to take the time to say thank you all, those of you that are viewing, those of you that are observing, those of you that are trying to learn more about the COVID-19 virus. We want to say thank you all. Your efforts and your engagement and your intensive awareness concerning the COVID-19 and how it has impacted the city of Milwaukee and the state of Wisconsin.
I'm sorry, everyone. Again, thank you so much for joining Greater Mount Sinai. Pastor, we thank you for this opportunity. We thank you for your leadership. We know that the church is the and the community is the church. Leadership. We know that. We also would like to thank the city of Milwaukee for being a participant in our COVID-19 awareness. We have with us Lillian Payne, which is the chief staff to our Milwaukee Commissioner, Jeanette, I'm gonna say her last, Kovic. So we thank you so much for joining us. We also would like to take this time to introduce a very special guest, our nurse, Nicole Hale, that is also with us today. Nicole Hale will be moderating the questions. Please feel free to comment and to question in your chat at the bottom. If we do not get an opportunity to get to your question, someone will reach out to you with an answer to your question. At this time, we're going to have everyone say hi, and then our very own Sister Nicole Hale will go into the questions that we have for our Chief of Staff, Lillian Payne.
Good evening, everyone. Thank you all for joining us. This is such an important topic, and as Pastor Davis had forestated, we have a tendency to perish because we are not knowledgeable, and so we are here tonight to share this pertinent information. Again, thank you for the help and the partnership with the Milwaukee Health Department to bring out this very important information, and we won't hold you long, so we'll just get right into the questions, starting with, what is COVID-19?
Good evening, everyone. I'm the Chief of Staff for Health Commissioner Jeanette Kowalik, and I hope you all can hear me. Yes? Okay. So the question is, what is COVID-19? COVID-19 is caused by the coronavirus, which has the scientific name SARS-CoV-2. COVID is a new virus that has not infected people before. This is why there is no vaccine. It's a part of a large family of viruses that are common in people and may be found in different species of animals. So camels, cats, cattle, and bats. Animals are like people and can get sick with a variety of viruses. Most of the time, these viruses only infect animals, but rarely they can spread to people. This happens when people come in close contact with an infected animal. Once the virus infects people, it can spread between people. And the Center for Disease Control has indicated that the exact source of the coronavirus is unknown, meaning that they are not aware of the kind of animal the virus originated in.
And so now we understand how, what COVID-19 is and how people are affected. Would you say that COVID-19 is over?
No, COVID-19 is not over. In the Milwaukee area, we are seeing new cases of COVID-19 daily. It is highly infectious and is affecting all areas of the city of Milwaukee. I can speak more to how it affects people and how people get it. Would you like me to talk about that? Okay, so COVID-19 is spread through respiratory droplets produced when an infected person, so someone that has the virus, coughs or sneezes. These droplets can land in the mouths or noses of people or breathe into your lungs. It's spread when people are in close contact with one another, like less than 6 feet, so not practicing social distancing. And a person can also get COVID-19 by touching a surface or an object that has the virus on it, and then touching their eyes, nose, and mouth. So it spreads. And it can live on surfaces like cardboard for 24 hours or in plastic for up to 3 days. A person who does not show any symptoms of COVID-19 can also spread the virus to other people.
And so what would be the testing process for COVID-19?
That's a great question. And I have an answer for you. This answer came in collaboration with our Milwaukee Health Department lab team. So the first step, what is the testing process? Currently, the testing process involves a sample collection of the nasopharynx, so up in your nose, in your sinus area. This means that a swab is put so far into the nose that it is sampling the potential virus. So up in there, deep up in there. And that swab is collected from patients by medical professionals. So a physician, a registered nurse, and it's typically in a clinical setting. So like when you go to your doctor's office or like urgent care. And upon approval of testing in the doctor's office, the swab is then sent and approved through a laboratory where a variety of methods are used to look specifically at the genetic material. So what makes up the virus under a microscope.
So once the testing is done, how long does it take for the results to come back?
That can also vary on a variety of factors, such as what lab is doing the test, which during the day it's received, which test method they're using, and the location of the lab and the lab's capacity. So the lab's ability to actually do the testing, the people power. Some labs have quick tests that have results that are available the same day, and others may take a few more days. Typically, the Milwaukee City lab reports within 24 hours.
And what's the cost of having this type of testing done?
Another great question. Cost depends on what route you're getting tested. So which way are you going about getting tested? It can be performed, the test itself, by public health laboratories, such as the City of Milwaukee Department Laboratory. Currently, there are no costs for high priority risk patients exhibiting symptoms, outbreak current situation. So thinking of hotspots and testing people in hotspots. Local healthcare organizations, such as hospitals, are also offering testing for diagnostic purposes and may or may not include a cost. The cost and test in a private lab, so clinical national referred lab, can vary between $50 and $200.
So you did mention hotspots. Some of us in the city of Milwaukee live in the hotspots. Can you identify what zip codes are considered the hotspots, and what should we do living in these areas that have been highly concentrated with COVID cases?
Yeah, this is a great time to refer you all to our City of Milwaukee Health Department. And I hope you can hear me. I'm trying to speak closer to the mic. Our City of Milwaukee Health Department COVID webpage. On that webpage is a dashboard where that information is updated every day by 2 p.m. So testing results come in at night, it's processed in the system. Most current numbers are cleaned and processed by the next afternoon. So today's numbers and hot zones are easy for you to find and view on the website. So you mentioned that some of us live in high-risk zip codes, and what should we do if we live in a high-risk zip code? That just indicates it's a highly infectious area, and that is important for individuals to follow physical distancing and hygiene guidelines in order to slow the spread and rate of infection.
Thank you for that response. And so would you say that African Americans are at higher risk for contracting this virus?
Our African American population, so us, has been impacted heavily in comparison to other populations, making up 55% of the total cases of COVID-19 in the city of Milwaukee. African Americans currently have a 3.5 time, so 3 times more likely to contract COVID-19 than whites. So whites are used as a baseline for data. So it's the comparison of that baseline information with the African American population testing results. This demonstrates a significant racial inequity and a need for increased outreach and resources. Possible driving factors include poverty, limited access to healthcare, increased likelihood of hourly work, so unable to telecommute, coming in contact with large amounts of people. There are also social, environmental, and institutional factors that contribute to higher rates of 2 diseases or comorbidities, 2 or more diseases happening at the same time among African Americans in comparison to whites. This may make the Black or African American population even more at risk and increase possibility and probability of severe symptoms, including death.
Thank you for sharing that. So we hear a lot about the underlying health issues. Could you help, or could you explain a little bit of what it means to have an underlying condition?
I am happy to explain that, and I'll go into detail. I would just like to mention that one of our trusted and reliable resources is the Centers for Disease Control and Prevention. And I can put in the chat box a link to groups at higher risk for severe illness for you to peruse at your convenience. So I'm putting that in the chat box now. And again, I hope everyone can hear me. So underlying health issues. Think of anyone with anything slightly respiratory. So asthma, smokers, people with COPD, having a chronic disease. Also, stress undermines the immune system and raises your blood pressure, and high blood pressure increases your risk of negative outcomes as it pertains to COVID-19. And then, unfortunately, being more likely to be underinsured or not having a primary care physician, and then higher environmental exposure that put our bodies at risk. So living near highways, bus transfer stations, which again impacts our respiratory systems.
If I feel ill, should I call the health department, or who should I contact?
That's a great question. We get that a lot. We are here to serve. We are public servants, but we are part of a larger team and bigger picture. And if you are having a medical emergency, we ask that you call 911 first. And then if you have health concerns that are not a medical emergency and you have a primary care doctor, please contact them. Call before going in person or to a clinic or hospital if it's a non-medical emergency. And then I can say this out loud and also make my way to putting it into the chat. If folks don't have a doctor, they can contact Froedtert Medical College of Wisconsin, Advocate Aurora Health, Ascension, Wisconsin, or visit Children's Wisconsin 24/7 online urgent care. And before I sign off, I'll try to type that in the chat for everyone.
That's good information. So you said Froedtert, Aurora, Children, and you Ascension?
Yes.
So all of our major healthcare facilities within the city. So again, if you do not have a primary care provider, you can contact Froedtert, Aurora, Ascension, or Children's Health.
Yes.
Our next question, and we know you have another meeting to attend, so we really
they understand. They understand that this is a priority.
So how can I protect myself day to day? Whether or not I have an underlying condition or if I feel like I'm healthy, how can I protect myself?
Again, a great question and something to think about every day, even when it's not a health emergency. So I just like to state again that there's no vaccine that can prevent COVID-19. The best way to prevent COVID-19 is to avoid being exposed to the virus. So that's why we have the Safer at Home order that was just extended to May 26th. And it's important, again, even when you don't have underlying health issues, to wash your hands with soap and water for 20 seconds after you've been in a public place, blowing your nose, coughing or sneezing. If soap and water are not available to you, use hand sanitizer that contains at least 60% alcohol. Again, avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home as much as possible, except for essential needs, like going grocery shopping, or if you have a doctor's appointment. Put distance between yourself and other people at least 6 feet. So again, think of when someone sneezes or coughs, that those droplets travel. And then now we are encouraging folks to wear cloth masks. The cloth mask, and again, staying at home, it helps you, but it's really protecting others that can't stay at home. And there's some guidance around mask making and how to clean them. So right now, we're encouraging folks, again, cloth face coverings. If you don't have access to a seamstress or don't have materials, a bandana is cloth fabric, wearing that. And that's guidance for people that are over the age of 2. You don't want to put something like that on a 2-year-old. And face cloth coverings should not be placed on anyone that has trouble breathing or otherwise cannot remove the mask on their own. And again, the cloth mask is meant to protect other people. Do not use a face mask meant for a healthcare worker. And always, again, cover your mouth and nose with a tissue when you sneeze or cough, and always cough or sneeze into your elbow. I have a couple more tips on how to properly throw away tissue. So use tissue in the trash, immediately wash your hands, clean and disinfect frequently. I know there's a shortage on disinfectant wipes and Lysol. I haven't been able to find Lysol myself. I'm glad I stocked up when I did. So I'm not saying it's easy to get a hold of these things now, but these are the things that help. And you want to disinfect everything you touch. We don't think about all the things we touch. You touch doorknobs, you touch light switches, countertops, desks, your phone, keyboard, toilet, faucet, sinks. I mean, I've gotten in the habit of wiping everything down, and I'm surprised that I miss spots when I touch handles on cabinets, for example.
Thank you. I just wanted to add, when you talked about the cloth coverings, such as a bandana, I think it's also important for us to remember that at the end of the evening, if you're wearing that all day, you should wash it, soap and water wash, and seems for you to use it the next day. We do at this time have a question from one of our
Hi, we have a question online. And the question says, on average, how many days is a person sick with the virus?
Thank you for that question. It sounds like the incubation period is what people are asking about. And the most recent example of that is the April 7th elections. Just this past Tuesday, that would have been a 14-day incubation period to determine if symptoms were exhibited pertaining to people potentially being exposed to the virus by doing in-person voting. So 14 days. And
So
feel free to add to that, Sister Nicole.
Okay, so I just wanted to talk about the incubation period. So sometimes when you're in that period, you don't necessarily have to have symptoms. And so just know that people can be infected without having symptoms first.
Yes. Thank you, Sister Nicole, for emphasizing that.
So the next question that we have, is it safe to go to doctor's appointments or use public transportation?
Yes. If you have a doctor appointment, please call your healthcare provider prior to going to that appointment to ensure that it's an essential visit. I can use myself as an example. I had a 6-month cleaning schedule and I got an email saying, sorry, your appointment was canceled. We're canceling all appointments until May 2nd. I was like, I thought 6-month cleanings were essential, but that means something different for different age groups and healthcare or general clinic settings and providers. So call ahead if you have not received notification that has been canceled, and talk to your healthcare provider about any restrictions, like the number of people coming in contact with you, if you were to come into the waiting room, and what to do if you have symptoms presenting like COVID-19. As far as public transportation should be used for essential trips only, so critical doctor appointments, grocery shopping, or other necessities like going to work. There's another question.
We do have another question. Someone is asking, is it that he has heard that people should wear a mask, but is it necessary, or should we only be using the mask when we're close in distance with each other?
Yeah, I think I understand the question. Like, is the mask necessary? And that's kind of it's a general requirement for essential workers, and that it's just a matter of time before that's a mandate, I think, a public health mandate. And that makes sense to wear a mask when you are out in public and there are people around you, potentially that could be around you within 6 feet. So within the house, with people that you live with, like someone staying with you, not someone visiting, I would say no in that scenario, if that makes sense. But if you have a visitor, which you shouldn't be having visitors anyway, wear a mask, or if you're going to go grocery shopping or use public transportation, wear a mask. And like Sister Nicole said, wash that mask in soap and water at the end of the day.
And I'd just like to also add to that, wearing masks shows part of our community responsibility. We could be asymptomatic or not have any symptoms, yet be carriers. We could be healthy, and because we have a stronger immune system, we are constantly, our body is constantly fighting off different infections and diseases constantly. So those who are on the healthier spectrum may be carriers and never exhibit any symptoms. So for a person of that nature wearing a mask, they are being mindful of other people around them. So it's not only to help me, it's also showing that I'm concerned about my community, I'm concerned about my neighbor, and this is a way that I'm identifying my concern and to help prevent the continual spread of this virus.
Yes. Amen.
So the next question that we have for you, do you know if everyone in the city of Milwaukee will eventually be required to have this test?
That is just like we have hot spots, that's a hot topic, and a political topic at that. And I am a neutral person in political conversations, just want to emphasize that. As a health department employee, my boss is the health commissioner and her boss is the mayor. So the rule for who gets tested, there are tiers to that priority list that changes regularly. It looks different than it did since our first case on March 13th, which was Friday the 13th, and we're 6 weeks in. So those, if you go back and look at documents and press releases that have been shared publicly, the more we know, the more we share. So at this time, high-risk people, such as people living in nursing homes or individuals with health problems, are being prioritized. Prior to that, it was healthcare workers. So again, this is constantly changing. It's a new virus and we learn more each day, and testing is to be expanded.
Thank you. I think it's also important to say, we had talked about earlier about going to medical appointments and contacting your doctor. I think we become our own best advocate. So if you're not feeling well, we have a responsibility, or if you're a caregiver and you're noticing that things are just not right, we do have a responsibility to advocate for ourselves and for those that we love. And we know some things are out of the ordinary. So although we're saying safer at home, if you're having a medical emergency, please contact 911. Please call 911. If you're just not feeling correct, have a conversation with your doctor. You may not be able to get into the appointment, but virtual appointments are available now, having conversations, and they can further direct you as well. So I just wanted to add to that piece about, when we get tested or when we're feeling sick. That's not to say during this time that we should not seek out health care advice. It's important that we seek out healthcare advice because we understand that other medical emergencies are happening on a day-to-day basis. They're not stopping because of COVID, and the hospitals are not shutting down because COVID exists. We have to learn how to coexist. And so please advocate for yourself. If you're not feeling well, please iterate that to your healthcare provider. Try to describe your symptoms as best possible to let them understand that there definitely is a change, because now we may not have the liberty of having that face-to-face contact. So your description, your narrative, your story is going to tell the story of what kind of care that you actually need. So I just wanted to add that to what you had said earlier, Leanne. But going on to the next question is,
Okay.
Can children contact COVID?
Yes, children can be infected with COVID-19. At this time, children do not appear to be at higher risk for COVID than adults. We can protect children by, again, washing their toys and clothes with warm water and soap. Dirty laundry from an ill person can be washed with other people's items, just as a FYI.
So thank you so much for that. And with that question, we would like to know, how long should someone, or if you're teaching your children how to wash their hands, how
Yeah.
long? I know we hear the birthday song, but how long should they wash their hands?
That's a good question. The commissioner was tagged by Chief Officer Morales in a hand wash challenge. It was on Twitter, and she tagged me. And I worked with a friend that's the director of the Walker Point Center of the Arts. And right now, that remix by Cardi B, the coronavirus remix, my challenge video was set to that song. So think of the chorus of a song, but singing it twice, or think of the lyrics and making it through 2 verses. So yes, like the birthday song, or I think a lot of people are thinking of Beyonce, Love on Top. So, and there's also an option to put your favorite song into a system that creates a chart for hand washing for 20 seconds. I can find that and put that in the link as well, if that would be beneficial.
That's great. You can always sing a praise and worship song twice through. This
True.
little light of mine.
That's true. I know
Praise
this
is what we
the church
do.
setting. I know
The
this is a church
storm will
setting.
be over. Sing that twice, and that's also a great time as well. Another question that we have is shifting the conversation. Someone would like to know, do you know if there's any resources for the small businesses that have been affected financially?
I am aware that there are groups, and I'm thinking of the mayor's cabinet. So Sharon Robinson, the administrator for that department, is a point of contact that can give you information on that. I will put her information in the chat. And there are several caucuses. So the Hispanic Chamber of Commerce, African American Chamber of Commerce, they are part of the bid communities, and those folks are having conversations. Organizations like LISC, I know that their goal during this pandemic is to keep all small businesses open on MLK Drive in the Bronzeville area. So there are efforts happening. I know in the media, from a federal position, there's talk of the small grant business loans disappearing, money running out, and the disparity in the large businesses getting that versus a small business. So that's ever developing, ever changing. But locally, we have our bid system and our department administration person that can assist with that.
Great. And
I
with
think
that,
another
we
good
have a
resource would be going out to, I was just going to add on to that, going on to the Small Business Administration website might be also a link that you can get more information from as far as federal funding.
Okay.
We had another question regarding a resource with families with the WIC program. Is there any
Yes.
information you can share with us with this, please, regarding a family that may need services?
I do have a response to that answer. Just one moment. I was trying to type in the text box. But we, as the City of Milwaukee Health Department, we are accepting WIC applications over the phone. Applicants can call 414-286-8820, and we can complete the application over the phone. To qualify for WIC, you must live in Wisconsin, meet the income guidelines, have a health or nutrition need. A nutrition assessment will be completed at the WIC clinic, and you can be a part of any of these categories. Pregnant, breastfeeding a baby under 1 year of age, had a baby or was pregnant in the past 6 months. You have a baby that's age 1, or you have a child that's younger than 5. And I'm putting the link where you can make your own hand washing poster. I will put the information about how to get a primary care doctor if you don't have one. And I will type in the WIC telephone number where you can complete an application over the phone.
And so our last question, how can I protect myself when I'm going out just for my essential needs?
Okay. So that's wearing a mask or a bandana, a cloth covering. Some people wear gloves, just like with washing the mask at the end of the day. I would recommend changing your gloves every time you do an activity. They carry things too. Gloves aren't free of germs. They carry germs too. And to practice proper hygiene. So coughing, sneezing into your elbow, using soap and water. If you don't have soap and water to wash your hands, using sanitizer that's 60% alcohol. And if you can, just staying at home or limiting your interactions with large groups of individuals.
Great. Thank you so much. Thank you so much for joining us. We are so appreciative for this moment. Are there any last minute information or any resources you would like to share with us that we weren't able to get within our questions?
Yeah, there's always resources to share. Just one moment. I was trying to verify that website. I can also share these links in the chat box, and then I'll have to step off. So I referred folks to the Center for Disease Control and Prevention website, our City of Milwaukee Health Department coronavirus webpage, the Wisconsin Department of Human Services, and there's additional testing information for Wisconsin on the Wisconsin Department of Health Services. So there's the Department of Human Services and there's the Department of Health Services.
Thank you so much. Nurse Hale, did you have any comments or again, any information you would like to share with us? And also we will get ready to end. And again, we are so grateful to the City of Milwaukee for allowing our chief our very own Sister Lillian to be with us on today. We are so grateful. Thank you so much. And at this time, we will see if Nicole have any questions or last minute comments. Also, if you're online, this information will be online. So if you still have questions, please comment and we will definitely get back with you to get you the resources that is needed during this time frame. And we're gonna when Sister Nicole finishes, we'll turn it over to our pastor and so he can cover us in prayer and we'll be ending soon.
Okay, so just to reiterate the importance of just some very practical approaches to how we can prevent or reduce the spread of COVID. The social distancing practice, masking when we're out in public places to go meet our essential needs. Also to make sure that we're doing proper hygiene. Also checking on one another. And during this time, there are a lot of us who don't mind being at home, but there's some people that are very outgoing, and this is a very challenging time. So also make sure that we're checking on people to make sure not only that they're physically healthy, but they're mentally and spiritually healthy as well. And so I like to say thank you as well to Lillian and Milwaukee Health Department for this great partnership and giving us expert information and sound practical approaches to how we can prevent the spread or reduce the spread of COVID.
Also, for those of you who are sharing our flyer, there's a number on our flyer. You can definitely call in with your questions as well. And we will try to get that information out to you. At this time, we're going to be able to close out. And so, Father God, we thank you for this time. We thank you for this space and opportunity, oh God. God, we know that you are covering us. Lord, you are in control. God, we just thank you again. We ask that this information is spread throughout the world, throughout the city of Milwaukee. And God, we ask that you cover everyone, oh God. Cover families, oh God. Cover all, oh God, who is going through something, oh God. God, we know that you are in control. We love you, oh God. In your son Jesus' name, thank God. Amen.